Hi, everyone. Good afternoon. Today, we're joined by Dr. Taki May, the medical director at Logan Regional Hospital, as well as a hospitalist here at Intermountain Healthcare, to give our COVID-19 update for the community. Dr. May, thank you so much for joining us. It's nice to have you.
Thanks for having me.
So we usually start these Facebook Lives going over our case counts and what's been happening since the last time I did one of these. And today's case counts are from the weekend. So the numbers I'll be reporting on are from Thursday, Friday, Saturday, just so everybody knows. So the numbers are 2,269 cases, which is up 49 from that same time period. Unfortunately, there were 9 deaths, and our hospitalizations are at 343, which is up 18% in the last 4 days. Our 7-day average positive rate is at 14.6%. And some interesting statistics for everyone: 98.5% of the people who have died from COVID-19 since January 16th have not been vaccinated. And 89.7% of the cases in this past week have also not been vaccinated. Let's start talking about that for a little bit. You work at Logan Regional Hospital. Can you tell us a little bit about how you're doing and how the hospital and your caregivers are doing with what's happening right now?
Sure. So it's been a rough 18 months. We have been very busy. Well, after the pandemic really got rolling in April and May, we really haven't had a slowdown. There tends to be a little bit of a cycle in healthcare, such that we usually see our volumes drop a little bit in the late spring, early summer, and we have just not seen that. And I think some of that's delays in care from the period of people isolating themselves. So right now we have high volumes of patients in the hospital, and we're really nervous about our COVID numbers rising because we remember what it was like when it was really bad. And I fear that we're heading there again.
You mentioned this fear. Does it seem like the caregivers are anticipating this to happen again? Is there anything you're doing or your team is doing to prep mentally or physically just deal with a potential surge that could happen with COVID?
Well, we are ready because we've already dealt with this. The difference is that, unfortunately, the stress of the pandemic really did hit healthcare providers in a significant way. Some nurses have moved into other areas of healthcare. Some have left the profession. Some have gone back to school. So here in Logan, as well as across the state and across the country, we're seeing a real staffing problem. So we're bursting at the seams, and if we have more patients with COVID coming in, that's really going to stress us out.
And we just got a question specifically around your hospital. Can you relate any stories of patients at Logan Regional Hospital who are unvaccinated and maybe expressed regret over not receiving the vaccine when they came down with COVID-19?
I personally haven't experienced any of those stories, but I know that those patients with COVID that I have taken care of, they recognize now that the vaccine would have been an opportunity for them. I have seen also my first unfortunate case of a fully vaccinated patient with COVID in the hospital. We have a 150-bed hospital here in Logan, so out of the many cases we've seen recently, just the one. But again, we knew this vaccine was not 100%. We know that it does protect against severe COVID in most cases.
That was actually another question we just received around breakthrough cases. Can you shed on any light if the percentage of breakthrough cases has gone up recently and what that could potentially mean for the state of Utah as well?
Sure. I know we have seen cases. We've had a caregiver here in our hospital who had a breakthrough case. I think we are going to see the breakthrough rate increase, and that's just because viruses mutate. It's part of what they are, and that's why we need a different flu shot every year. So I think as our variants become more diverse, they're going to escape our vaccines. But right now, the vaccines that we have are still very effective against the variants that we're seeing, and we really need the entire population to participate in the vaccination effort, because that's how we stop the virus in its tracks.
And I think it's important to note on that too. I've seen a lot of people talk about these breakthrough cases, and what people aren't looking at is the number of people vaccinated versus breakthrough cases. And I think that's very important to talk about. Is there's a really high denominator and a lower numerator, but you hear about these people who
Right.
are having breakthrough cases. Can you
You
talk a
hear
little bit
about
about
them
that?
because they're unusual,
Yes.
right? Every day when you get in and drive your car, you don't think, oh, I could get in an accident today. We hear about accidents because they're unusual. So I think people need to change their mindset and recognize that we hear about the scary stuff because it's scary. We don't hear about the mundane stuff, which is millions of people successfully vaccinated avoiding COVID.
I want to talk specifically a little bit about your region and vaccines. How are vaccinations going in the Cache Valley area and COVID in particular? Has there been an increase at all in either of those things?
Yeah, so in Cache Valley, Cache County, we have a vaccination rate for adults of about 57%, which is good, but not great. A little lower for the Bear River Health District in which Cache Valley sits. We have seen an uptick in our COVID cases over the last 2 to 3 weeks. We were to the point where we were seeing single digit numbers on a daily basis, and then we went into the teens, and now we're seeing 25 to 30 cases a day. I think we're under testing too. So unfortunately, I think there's more COVID than we're aware of.
That's another thing I actually wanted to bring up is how the new variants affect people as far as symptoms go and when someone should get tested. Is there a difference between how you're going to feel? Let's just take unvaccinated first, and then we'll go to vaccinated. Is there a difference between how you're going to feel with the Delta variant versus other variants when it comes to symptoms?
I've seen some information suggesting that the loss of taste and loss of smell that we saw early on in the pandemic may be less common with the Delta variant. But unfortunately, COVID has a really wide range of presentations in general. Even in the beginning, we saw some patients who just had, a runny nose or a sore throat. Some people had gastrointestinal symptoms, and some people were really sick. So in general, COVID has a very heterogeneous presentation, which makes it difficult. I think at this point, I would tell anyone who had any type of respiratory symptoms, it's worth getting tested because it could be COVID. The gentleman that I was taking care of this weekend who was vaccinated thought he just had a cold, and it turned out it was COVID.
That was going to be my other question around vaccinated people as well. At what point should I be getting tested if I'm feeling anything? It is hard for me to wrap my head around, and I'm sure everyone, that if I have a little tickle in my throat or if I'm feeling a little bit under the weather, that I should automatically go get tested. Is there a certain point where it's necessary to go get tested? What are your thoughts on that?
I definitely think if you've got a fever associated with it, most of the common colds don't have significant fever. One of the symptoms I saw in most of the patients that I've taken care of is this incredible fatigue. And so I would be worried about that. And then, of course, if you're short of breath, there's lots of reasons why you could be short of breath that aren't infectious. So that would warrant a checkup.
And as far as vaccines go throughout the entire state as well, is there a particular area that is kind of lagging behind or doing particularly well? And what could one area mean for the rest of the state if we're not kind of keeping up with the par there?
So, we live in a global economy, so people are moving back and forth into different areas. I think we all need to try to get our vaccination rates up. Rural communities probably have a much lower vaccination rate just because of access issues, and I hope that every health department is working to address those. We know that COVID rates are higher in more heavily populated areas, and that's probably just a factor of more people gathering. In terms of which counties have lower vaccination rates, unfortunately, I'm not familiar with those specific data, but we know that there are counties that do have lower vaccination rates, just like we have states with lower vaccination rates where we're currently seeing a COVID surge. Places like Alabama, Missouri, really seeing their hospitals filling up with cases of COVID.
And I liked how you put that we have a global economy. People aren't just sitting in a bubble and not moving around. And it's important to remember that too when you're traveling to other places, how important that vaccine is so that you're not spreading potentially COVID around. So I'm glad you brought that up. And I want to talk a little bit more about those variants as well. Is the Delta variant that is very widely talked about now, I think it's like 85% of the cases in the
Yeah.
US, is it more deadly, more infectious? What's the difference between that and the the main mutation that we're used to?
Yeah. So I was looking at a study recently where it showed that folks who were infected with the Delta variant had 1,000-fold increased carriage of the virus in their nasal passages. And so that means if you sneeze, you're going to be distributing a lot more viral particles than the person who had our previous dominant variants. So yes, definitely more infectious. And we're getting some increased data that suggests that this is probably more deadly as well, unfortunately. And I can tell you from working the weekend, the patients we're seeing in the hospital are younger and healthier than the folks that we saw last spring.
Should we be taking extra precautions because of this? It seems like I've definitely seen an increase of people wearing masks again in grocery stores and just out
Yep.
and about. And I know that a variety of different counties and different states have brought back their mask mandates.
Right.
But as far as personal precautions go, when is it appropriate for someone to start masking up again? What are your thoughts on that?
So really it's about, do you know the people that you're hanging out with? Do you know that they're vaccinated? Do you know that they're healthy? If you see someone who is sniffling or coughing, I would definitely wear my mask around them. I personally wear a mask when I go to the grocery store because I know that my community is only about 55, 57% vaccinated, and most people aren't wearing a mask, which means that there are a number of potentially unvaccinated infectious people there. And I happen to have two parents who are both immune compromised, both vaccinated, but we don't know that they actually have antibodies that are protective. So, for protection of myself in my role and in my family, I want to make sure that I'm taking every precaution I can. That may not be the same choice that everybody's going to make.
The antibody piece you just brought up was really interesting. Is there
Yeah.
actually a way for an average person to find out how much antibodies their body is producing or had or has at all?
Unfortunately not. The antibody tests that we have just say basically detected or not detected, but they can't tell us whether we're protected. To what degree. I will say that if you want to know whether you have any antibodies, you can go donate blood, plasma, or platelets at the Red Cross. They are currently screening all of their donors for the possibility of antibodies. So, and you'll be doing a good thing because we're also facing a blood shortage right now.
Yes.
Summer is always a time when we see the number of donations go down. And unfortunately, with the trauma season, we see our needs go up. So that would be a good way to help your community and learn whether or not you actually have any antibodies.
That's a great idea, actually. I didn't know you could do that. So thank you
Yep.
for that. Another thing I keep hearing is that because the vaccine is not fully FDA approved, that people are hesitant to take the vaccine for that reason. Can you talk through what it takes for something to be FDA approved and also when we might see the vaccines be completely
Sure.
FDA approved?
So, in order to even seek FDA approval, a drug or a vaccine has to be studied in a fairly large population. And we were actually able to get a lot of studies rolled out early on because COVID's been so prevalent in our communities. So we were able to actually Pfizer and Moderna were both studied in populations of 30 to 35,000 to understand that these really were very effective vaccines. I think the Janssen vaccine was not quite as large of a study, but well studied. But again, because it was a new technology that was used to produce these vaccines, they only got emergency use authorization. I'm hoping that we'll see full vaccine approval maybe sometime in the fall.
Sorry, couldn't get off mute there for a
Yep.
second. With the fall too, there's a lot of questions around children that are younger than 12, especially as
Yeah.
school goes back into person. School starts in Utah as early as like 3 weeks from now, which is crazy.
Yeah.
Do you have any suggestions for parents who are sending their children back to school who are not at that 12-year-old range yet?
Sure. You know, it was interesting last winter. During the winter, we typically see a lot of viruses circulating in the community, and we see pediatric patients being hospitalized every year. You know, several hundred children die from influenza every year during the flu season. We didn't see any of that last winter, and it's because we were social distancing and masking. Um, I am worried about the kids going back to school with the vaccine not being available to them because they're not great at hand hygiene. They like to share things, including germs. I think it's a good idea to have kids masked, and the American Academy of Pediatrics has recommended masking for kids going back to school this fall.
And hopefully we'll hear a little bit more about when the vaccine will be available. I know we keep talking about fall, maybe early next winter. Is there any more details about when that could possibly start rolling out to that age range?
Yeah, I haven't followed the pediatric literature a ton. I know there are some studies ongoing, and part of the problem there is I'm guessing that there's some enrollment hesitation on the part of parents. Some people will be cautious about enrolling their children in a clinical trial for a new vaccine. But the reality is, these trials are the only way we're going to know that these vaccines are safe and effective, and it's the only way that medicine progresses in general.
Another question around that as well, there's been a lot of conversations too around 15, 16, 17-year-olds who want to get the vaccine themselves, but their parents don't want them to, and you do need to be over the age or have a guardian sign off for most vaccines. Do you have any advice on how children who are eligible can talk to their parents about why they want to get vaccinated?
So I think the big thing for me would really be trying to understand why their parents are hesitant, and I would try to engage the pediatrician that's involved in the care of the youth to help maybe overcome the fears that the parents may have about the vaccinations.
Sorry, go ahead.
Most doctors are pro-vaccine because we live in a world with lots of vaccines available, and we know that we are preventing all types of illness with the various vaccines that we give kids routinely.
And I'm sure that's a very difficult conversation too, but the pediatrician route is a great idea. Getting your doctor involved and having that discussion one-on-one with them is a great idea.
Right.
My last question for you is around the importance of not delaying care if something happens just because we're having this increase of cases. Can you talk about that? I feel like I'm having deja vu where I'm back to October of last year.
Yeah, we know, for instance, mammography screening rates for breast cancer in women went down during the pandemic, and the result of that is going to be an increase in later diagnoses of breast cancer and things like that. Certainly for any serious medical condition, if you're having chest pain and shortness of breath, you could have a serious medical condition and you do need to seek care. We take a lot of precautions in the hospital to keep our patients safe. We try to identify early on if you have potential symptoms that may be COVID related, we're going to place you in isolation. So if you are coming in for a different type of condition, we have the ability to keep you safe. We want to provide you with the care you need. And delaying care usually means that your condition is going to show up in a more serious state. So please don't delay your care.
Well, thank you so much for all the great information. And if anyone is watching has not been vaccinated yet and would like to get more information, you can go to intermountainhealthcare.org/COVID vaccine. There's resources for health departments and areas where you can receive the vaccine, as well as just general information as well. Dr. May, thank you so much. I appreciate your time, and we'll talk with you later.
Thanks for having me. Take care.
Thanks.